I'm about to tell you something that could save your life, and it has nothing to do with a new sleeping pill or a fancy mattress. It has to do with how you breathe in the last minute before you try to fall asleep. Most seniors I treat think sleep problems are just part of getting old. They toss, they turn, they stare at the ceiling at 2 a.m., and then they drag themselves through the day. What they don't realize is that chronic insomnia is not only miserable, it dramatically increases your risk of high blood pressure, atrial fibrillation, heart attack, stroke, and even dementia. And here's the part almost no one over 60 has been taught. There is a simple military-style breathing trick that can flip your nervous system from fight or flight into rest and digest in under a minute. Used correctly, it can help many seniors drift off in about 47 seconds of focused practice. I'm Dr. Claire Whitmore, and after 2 decades as a cardiologist, I've admitted thousands of seniors to the hospital with heart conditions that were fueled quietly, relentlessly, by years of poor sleep. I've watched monitors as their hearts raced at 3 a.m., driven by stress hormones rather than clogged arteries alone. Over and over, I've wished someone had shown them how to calm their own nervous system naturally before they ended up in my ICU. By the end of this video, you'll know exactly how to do this 47-second breathing method, how many cycles to use, how to adapt it safely if you're over 70 or have lung or heart disease, and how to build a short bedtime routine around it that trains your brain to let go. But I am not going to teach you the exact pattern yet, because if I do, some of you will try it once, say, "That didn't work," and walk away. You need to understand what is happening inside your body when you can't sleep, especially after 60, before this trick will really work for you. Before we dive in, I want you to participate. Comment below with your age and how many hours you usually sleep at night. Something like 72, 5 hours, 83, 4 hours broken, or 68, 7 hours but not restful. If you're awake between 1 and 4 a.m., most nights add the word awake. I read these. I need to see how seriously seniors are struggling with sleep. Let me tell you about Joan. Joan was 78 when I met her, retired librarian, widowed, lived alone in a small condo. On paper she was doing okay, 5'3", 154 pounds, blood pressure around 142, over 84 on medication, cholesterol on a statin with LDL 96, HDL 52. She had mild osteoarthritis and a history of high blood pressure, but no prior heart attacks or strokes. Her medications were a blood pressure pill, a cholesterol pill, and something for heartburn. Her real problem, the one that was quietly wrecking her health, didn't show up in the lab work. It showed up at 2:17 in the morning, every night. Joan hadn't slept well in years. After her husband passed away when she was 72, her sleep, which had never been perfect, shattered. At first, she chalked it up to grief. Then it became normal. She would lie down at 10 p.m., fall asleep around 11 or 11:30, and then, like clockwork, snap awake around 2 a.m. Heart pounding, mind racing. She would stare at the green numbers on her alarm clock as they crawled toward 4:30 or 5 a.m. At her annual visit at 74, she told her primary doctor, "I just don't sleep, maybe 4 hours a night." He replied, "Unfortunately, insomnia is very common in seniors. Try some over-the-counter melatonin. Avoid caffeine late in the day." He suggested a low-dose sleeping pill for occasional use, but warned about falls and grogginess. She tried melatonin. It didn't do much. Over the next year, bad nights outnumbered good ones. To cope, Joan developed a routine many seniors will recognize. When she woke at 2 a.m. and couldn't get back to sleep, she'd shuffle to the kitchen, make chamomile tea, and eat a couple of crackers so I don't feel empty. She'd sit in her recliner with the television on low, old movies, late-night news, until she felt drowsy again around 5 a.m. Then she'd crawl back into bed just as the sun came up. By 8:30, the alarm jarred her awake again for a doctor's appointment, or church, or a volunteer shift. She'd drag herself through the day, nap in the afternoon, and then repeat the cycle. At 75, her blood pressure crept up, 152 over 88. Her doctor raised her medication. At 76, a Holter monitor, a 24-hour heart rhythm test, showed occasional extra beats and brief runs of a fast rhythm called supraventricular tachycardia, mostly between midnight and 4 a.m., probably benign, the report said. No one connected the dots between those nighttime adrenaline surges and her terrible sleep. The warning signs kept coming. Joan started forgetting words mid-sentence. Her daughter noticed she was more irritable and teary. "Mum, you sound so tired all the time. Are you sleeping at all?" Joan would joke. "I'll sleep when I'm dead." But privately she was scared. She tried an over-the-counter PM pain reliever that contained an antihistamine. It knocked her out, but she woke up groggy with a dry mouth and unsteady legs. She nearly fell in the bathroom one morning. She stopped that experiment. At 77, her insomnia worsened. She started taking the prescription sleeping pill her doctor had given her, only for special occasions several nights a week. At first it seemed like magic. She'd fall asleep faster, but she still woke at 3 a.m., only now she felt even more disoriented. Some nights she'd take half a second pill at 3:30, even though the instructions said not to, just to knock herself out again. No one knew. She didn't want to bother the doctor. The crisis came on a humid August night. Joan had gone to bed at 10:30 p.m., taken one sleeping pill at 10:15, and drifted off around 11. At 2:12 a.m., she jolted awake with a familiar wave of anxiety, but something was different. Her heart was pounding in her chest, fast and irregular, like a fish flopping. She felt a band of tightness across her chest, not quite pain, but deeply uncomfortable. She sat up. The room tilted slightly. She looked at the clock. 2:13 a.m. Not again, she whispered. She stood up to go to the bathroom. As she took 2 steps, she felt weak and lightheaded. Her heart thudded in her ears. She grabbed the dresser and sat back on the bed, breathing fast. After 5 minutes of this, she did something she hadn't done before. She called 911. The dispatcher's voice was calm. "Stay on the line with me. Help is on the way. Are you having chest pain?" "Not exactly," Joan said, "but my heart is racing. I can't slow it down. I can't catch my breath." When the paramedics arrived, they found her pale and clammy, perched on the edge of the bed. Her blood pressure was 176/96. Her heart rate was 148, irregularly irregular. The EKG strip showed atrial fibrillation with rapid ventricular response, a chaotic rhythm where the top chambers of the heart quiver instead of pumping effectively. In the emergency room, I was called. We gave her medication to slow her heart and thin her blood. Over the next several hours, her rhythm settled, but she remained exhausted and shaken. We admitted her to the telemetry unit for monitoring. Labs showed her thyroid was normal. Her electrolytes were okay. Troponin, the heart attack marker, was mildly elevated, suggesting demand ischemia. Her heart muscle had been under stress. As I sat by her bed the next morning, I asked, "Joan, walk me through your nights. Not just last night, your usual nights." She hesitated, embarrassed, then described years of lying awake, the 2 a.m. awakenings, the late-night TV, the occasional extra sleeping pill. When she finished, I said gently, "Joan, your heart is trying to live in a war zone 24 hours a day. You're lying still, but your nervous system thinks you're under attack. That's a big part of why this rhythm happened." She started to cry. "I just want to sleep," she said. "I didn't know how else to make it stop." Joan's hospital stay stabilized her heart rhythm, but it didn't cure the root problem. Over the next year, despite medication, she had 2 more atrial fibrillation episodes, one at 3 a.m., one at 4:30 a.m. each time. She ended up back in the hospital. Her memory and mood worsened. Her daughter finally moved her in, just to keep an eye on her. The independent woman who had run a library now needed help sorting her pill box and tracking her appointments. Here is the painful truth. So much of this could have been different. Not all of it. I will never tell you that a breathing trick cures atrial fibrillation or guarantees perfect sleep. But if, when Joanne's insomnia first began, someone had taught her how to calm her nervous system at night without pills, how to signal to her heart and brain that it was safe to stand down, we might have prevented years of chronic sleep deprivation and some of those nighttime arrhythmias. Before we go further, I want you to check in with yourself. Comment again, this time with age, bedtime wake-ups. For example, 79, bed at 10, awake 3-4 times, or 83, bed at midnight, awake at 2 and 4. If you use sleeping pills more than twice a week, add the word pills. If your heart sometimes feels like it's racing at night, add the word racing. A comment might look like 76, bed 9:30, awake at 1 and 4 pills racing. This is not about judgment, it's about seeing how common this pattern is. Now, let's pull back the curtain on what's actually happening inside your body when you can't sleep, especially after 60. Most of the advice seniors get around sleep is simplistic. Turn off screens, don't drink coffee late, get some exercise. That's fine, but it misses the core issue. Your nervous system is stuck in high gear. You've heard of fight or flight. That's your sympathetic nervous system, the part that gets you ready to run from danger. Your heart rate goes up, your blood pressure rises, your muscles tense, Your mind becomes hyper-alert. This system saved your ancestors' lives when a predator appeared. The flip side is your parasympathetic nervous system, sometimes called rest and digest. That's the branch that slows your heart, lowers your blood pressure, and allows for deep restorative sleep. In a healthy younger adult, these two systems dance, sympathetic by day when needed, parasympathetic at night. But for many seniors, that balance breaks. Why are adults over 60 different when it comes to sleep? First, your stress response is more easily triggered and slower to shut off. Years of responsibilities, losses, medical procedures, and chronic illness mean your brain and adrenal glands are primed to release cortisol and adrenaline even for minor stresses. A small worry at 2 a.m. that a 30-year-old might shrug off can flip a 75-year-old's body into full alarm mode. Second, your sleep architecture changes. You naturally spend less time in deep slow-wave sleep and more time in lighter stages. That means you wake more easily to noise, to pain, to a full bladder. Once you're awake, if your sympathetic system is revved up, it's much harder to drift back off. Third, medications. Many seniors take drugs that affect the nervous system: beta blockers, decongestants, antidepressants, steroids, even certain blood pressure pills. Some of these, especially when taken late in the day, can interfere with melatonin, increase nightmares, or raise your heart rate. Sleeping pills themselves, benzodiazepines, Z drugs like zolpidem may knock you out, but they do not produce normal sleep. They suppress deep restorative stages, worsen breathing and sleep apnea, and increase fall risk. Fourth, underlying heart and lung issues are more common. A 30-year-old waking at night with a racing heart is usually anxious. A 78-year-old may also have stiff arteries, atrial tissue prone to misfiring, or lungs that don't exchange oxygen as well. For you, calming the nervous system isn't just about comfort, it's about protecting a heart and brain that are more vulnerable to stress. So where does breathing come into this? Your breath is one of the few levers you can consciously control that directly influence your autonomic nervous system. Slow, deep, controlled exhalations send a powerful signal through the vagus nerve, a major parasympathetic highway, telling your heart, you can slow down now, you are safe. This isn't woo-woo, it's physiology. We have solid research showing that paced breathing, especially patterns with longer exhales than inhales, can lower blood pressure, reduce heart rate, and increase heart rate variability, HRV, a marker of healthy autonomic balance. Studies in adults with insomnia have shown that regular practice of slow breathing before bed can improve sleep onset and quality, measured by both questionnaires and sleep studies. For example, trials of diaphragmatic breathing in older adults have shown reductions in the insomnia severity index and improvements in subjective sleep quality. Paced breathing at around 6 breaths per minute, that's 1 breath every 10 seconds, has been shown to optimize baroreflex function, the reflex that stabilizes blood pressure, and increase parasympathetic activity. Military and tactical units have long used variations of these techniques under names like box breathing or tactical breathing to keep soldiers calm, focused, and able to perform under extreme stress. The reason is simple. When your nervous system is in a controlled rhythm, your thinking clears and your reactions become more precise. For years, seniors were told, if you can't sleep, get up and read. Don't lie there and stew. That's not wrong, but it ignores the fact that you can actively steer your nervous system away from red alert and towards sleep with nothing but air and attention. Here's the contrarian truth. While many adults over 60 reach for pills or resign themselves to endless bad nights, the most powerful switch you have for sleep is already built into your body. When you learn to use a simple, structured breathing pattern and practice it consistently, you often can fall asleep faster, return to sleep after awakenings, and lower your nighttime heart stress without adding another medication. You've waited long enough. Let me teach you the 47-second breathing method I want every senior to know. Then we'll talk about how to fit it into a safe bedtime routine and what questions to discuss with your doctor. The pattern we'll use is a modified form of what many call military or tactical breathing, optimized for older lungs and hearts. The core idea: inhale gently through your nose, hold briefly, then exhale slowly and fully through pursed lips, with the exhale longer than the inhale. One full cycle takes about 15-16 seconds. 3 cycles are around 45-48 seconds. That's your 47 seconds. Here's the step-by-step. Do this lying on your back in bed with your head supported and your body comfortable. If you have sleep apnea and use a CPAP, do it with your mask on. Step 1. Gently exhale through your mouth to empty your lungs to a comfortable level. Don't force, just sigh the air out. Step 2. Inhale quietly through your nose for a slow count of 4. Not a huge breath, just let your belly and lower ribs expand gently. 1, 2, 3, 4. Step 3. Hold your breath just comfortably for a slow count of 4. 1, 2, 3, 4. Step 4. Exhale slowly through pursed lips like you're blowing out a candle very gently for a count of 6. 1, 2, 3, 4, 5, 6. That's one cycle. 4, 4, 6. For many seniors, this is easier and safer than 4, 7, 8 or 4, 4, 4, 4. One cycle is about 14, 16 seconds. Do 3 cycles in a row. That's your initial 47 seconds under a minute of focused breathing. If you feel lightheaded, shorten the hold or the exhale. For example, use a 3-3-4 pattern. If you feel fine, you can gently work up over days or weeks to a 4-4-8 pattern. Inhale 4, hold 4, exhale 8, which deepens parasympathetic activation. Here's how to put this into a simple bedtime routine. About 30 minutes before bed, dim the lights. Turn off news and stimulating TV. If you're on a smartphone or tablet, use a blue light filter or better yet, set it aside. Do any nighttime medications as prescribed. Then, when you actually lie down and turn off the light, instead of immediately wrestling with your thoughts, say to yourself, "Now I do my breathing." Lie on your back or your side, whichever is more comfortable. Place one hand lightly on your belly to feel it rise and fall. Close your eyes, then breathe normally once or twice. Then begin, inhale through your nose for 4, hold 4, exhale through pursed lips for 6. Repeat this 3 times, counting slowly in your mind. If after 3 cycles you feel calmer but not yet drowsy, you can do up to 8, 10 cycles. Many seniors find that somewhere between the 4th and 10th cycle, their thoughts blur and they drift off. A few important points. You should never strain for air or feel like you're suffocating. This should feel like a gentle stretching of your breath, not a contest. If you have severe COPD, advanced lung disease, or significant heart failure, talk to your doctor before doing long breath holds. In those cases, a pattern with no hold and just a longer exhale, like inhale 4, exhale 6, may be safer. If you notice chest pain, severe shortness of breath, or dizziness during this practice, stop and tell your doctor. Do not push through these symptoms. Now, breathing alone is powerful, but it works best as part of a small, consistent system. Here's a simple 6-step protocol you can follow. Step 1. Protect the hour before bed. Choose a consistent bedtime window, ideally between 9 and 11 p.m. In the hour before, avoid heavy meals, alcohol, and intense news. Keep lights low, aim for the same wake time every day, even if your sleep was poor, to help reset your internal clock. Step 2. Do a worry. Download before you even get into bed. Take 5 minutes earlier in the evening to write down anything that's on your mind. Appointments, bills, medical worries, then write one small action you can take tomorrow for each, or simply write, "Think about this at 10 a.m. This tells your brain we don't have to solve this at 2 a.m., it's scheduled. Step 3. Use the 47-second breathing method when you first lie down. 3 cycles minimum, up to 10. If you're still wide awake after 15-20 minutes, you can get up briefly, sit in a dim room, read something neutral, and then return to bed and repeat the breathing cycles. Step 4. Use the same breathing if you wake at 2 or 3 a.m. When you wake in the night, don't grab your phone or turn on bright lights. Note the approximate time, then immediately start your 4-4-6 breathing, eyes closed. Tell yourself, my only job right now is to breathe slowly. If after 15-20 minutes you're still completely alert and frustrated, then you can get up briefly, but always start with the breathing. Step 5. Coordinate with your medications. If you're taking beta blockers, asthma meds, or certain antidepressants at night and noticing more insomnia, ask your doctor if any of them can be moved to the morning. If you're using sleeping pills regularly, do not stop them suddenly on your own. That can rebound your insomnia and, with some pills, cause withdrawal. Never change or stop a sleeping medication without talking to your doctor first. You can, however, start practicing the breathing method alongside your current regimen and then discuss a gradual taper if you and your doctor agree. Step 6. Track your progress. For at least 2 weeks, keep a simple log. What time you went to bed, how many breathing cycles you did, roughly what time you fell asleep, and how many times you woke up. You don't need to be exact. Then look for trends. Maybe at first you needed 10 cycles to feel drowsy, and after a week you need 6. Maybe your 2 a.m. awakenings shrink from an hour to 20 minutes. These changes matter. Seniors often have good questions about this approach. One is, what if my mind won't stop racing, even when I breathe? That's where you combine breathing with a gentle focus. For example, as you inhale, mentally say calm, and as you exhale, mentally say down, or count your breaths up to 10, and then back down. The goal is not to empty your mind completely, it's to give it something simple and repetitive to hold, so it doesn't run wild. Another question, can I do this during the day when I'm anxious? Absolutely. In fact, practicing this breathing in the daytime when you're not exhausted and desperate trains your body so that at night it's familiar. Use it before a stressful phone call, in a doctor's waiting room, or when you feel your heart speed up. Many ask, will this work if I have sleep apnea? Paced breathing is not a treatment for sleep apnea, and if you snore loudly, gasp in your sleep, or have been told you stop breathing at night, you need a sleep study and possibly CPAP or another treatment. What this breathing does is calm the nervous system around the episodes, making it easier to fall asleep and return to sleep, but it does not open a collapsed airway. Never use breathing techniques as a substitute for treating known sleep apnea. Some are concerned, is it dangerous to slow my breathing if I have heart disease? For most seniors with stable heart disease, gentle, slow breathing is not only safe but beneficial. It reduces blood pressure and heart rate fluctuations. But if you've had recent unstable angina, a recent heart attack, severe aortic stenosis, or severe shortness of breath at rest, talk to your cardiologist before starting any structured breathing routine. You may need a shorter pattern initially, like inhale 3, exhale 4, no holds. And finally, what if it doesn't work the first night? That is normal. This is a skill, not a magic switch. In the famous military sleep method used to train pilots, it took many trainees several weeks of daily practice before they could fall asleep in under 2 minutes in difficult conditions. The brain learns by repetition. Give yourself at least 2-4 weeks of consistent nightly practice before you judge it. Let me share a more hopeful story. One of my patients who used this approach to change her nights. His name is Frank, 74, retired school principal. He came to me for high blood pressure and episodes of chest tightness. He was 5'11", 204 pounds, blood pressure 158/92 despite 2 medications, LDL 118. His A1C was 5.9%, technically not diabetic. On paper, we needed to adjust his pills, but as I took his history, I heard something else. How are you sleeping? I asked. He laughed bitterly. Terribly. I go to bed at 10, I'm asleep by 11, and then I'm up at 1:30, 3:30 and 5. I'm exhausted. I doze in my chair every afternoon. His Apple Watch showed his heart rate often spiked into the 90s and 100s at 2 or 3 in the morning while he was supposedly sleeping. He didn't use sleeping pills, but he drank a glass or 2 of wine at night to unwind. We agreed to tackle both his blood pressure and his sleep. We adjusted his medication slightly, cut the evening wine to 1 small glass no more than 3 nights a week, and introduced the 47-second breathing routine. I asked him to do 6 cycles at bedtime and at least 4 cycles each time he woke in the night before he even thought about getting out of bed. I also had him keep a 2-week log. At his 3-week follow-up, he said, "I'm not going to lie to you, the first few nights my mind kept wandering. I'd forget what number I was on." I told him that was expected. Then he added, "But around the 5th night something changed. I finished my cycles and realized I couldn't remember what I was worrying about. I don't know exactly when I fell asleep, but when I looked at the clock the next time, it was 4:45 instead of 2 o'clock. At 8 weeks, his log showed that he was falling asleep within 20-30 minutes most nights instead of lying awake for 90. His nighttime awakenings had dropped from 3 or 4 to 1 or 2, and he was returning to sleep faster using the breathing instead of turning on the TV. His average blood pressure had come down to 136/82, with the help of both medication tweaking and better sleep. His morning heart rates were lower. His wife reported he was less cranky and more like his old self. 6 months later, he told me, "If I skip the breathing, I notice it. My mind races more. If I do it, even on a bad day, it's like giving my brain permission to shut down." He still had occasional rough nights, especially when he was sick or worried about family, but the pattern of chronic insomnia had broken. I think about John every time I teach this breathing method. I picture her staring at her alarm clock at 2:17 a.m., heart pounding, thoughts chasing themselves. No one had ever shown her that in less than a minute, with nothing more than a gentle, structured breath, she could send a powerful message to her heart and brain: "You are safe. You can stand down." I cannot go back and change her story, but I can give you what she didn't have. You now understand that after 60, insomnia isn't just annoying, it's a serious stressor for your heart and brain. You know that your nervous system can get stuck in fight or flight even when you're lying still in bed, and that sleeping pills alone often mask the problem while adding new risks. You've learned that slow, controlled breathing with longer exhales directly engages your parasympathetic system, lowering heart rate and blood pressure, and preparing your brain for sleep. You have a concrete pattern, inhale 4, hold 4, exhale 6, that you can practice for as little as 47 seconds at a time. And you know you can weave this into a small bedtime routine, track your progress, and coordinate it with your medical care. This information is power, but only if you act. Tonight, when you lie down, don't just brace yourself for another battle with your thoughts. Close your eyes, put a hand on your belly, exhale gently, inhale for 4, hold for 4, exhale for 6. Do 3 cycles. If you're still awake, do a few more. When you wake at 2 or 3 a.m., do a karo at 3 a.m. Resist the urge to reach for your phone or the remote. Give your breath a chance first. Do it every night for the next few weeks and watch for those small shifts. Talk to your doctor about your sleep. Bring your log. Ask if any of your medications might be affecting your nights and whether a referral to a sleep specialist is appropriate, especially if you snore, gasp, or suspect sleep apnea. Never change or stop a sleeping pill or other prescription on your own. Always do it in partnership with your physician. Before you go, do 3 things. Subscribe if you want more direct, honest guidance about protecting your heart, sleep, and independence after 60. Share this video with at least one friend or family member who lies awake at night or relies on pills to sleep. You may give them a safer, more powerful tool. And leave a comment with one of 3 phrases: trying the breathing, if you're going to start tonight, already using breathing, if this confirms something you do, or talking to my doctor, if this has convinced you to bring up your sleep at your next visit. Your nights don't have to be a battlefield. With less than a minute of focused breath, you can begin to retrain your brain and heart to rest. Disclaimer: the content in this video is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician regarding your medical condition. Never change your medication dosage or start a new breathing or exercise routine without consulting your doctor.